Hi, this is Nora De Silva. My host today is Dr.Raed. He will talk about the health of the liver. Hi, Dr.Raed. Welcome in my channel today.
Thank you, Nora, for having me.
How are you doing?
I'm good. Yeah, I can't complain.
Tell me about your specialty and what kind of patients do you see?
So I'm a gastroenterologist, which basically means a doctor that looks after the gut. So look through the bowels, stomach, colon. I also deal with a couple of other organs, which include the liver and the pancreas. And as part of my sort of extra specialty is I do hepatology, which is a specialty of the liver disease. So I do look after patients a lot with who have complications of liver disease or just in general liver health.
Okay. What liver condition do you believe is most prevalent in our population?
So if we are talking about the northwestern population, we have a few pretty high risk liver complications or people who are at risk of liver disease. As you know, alcohol is being one of the major factors. But there's also others like viruses like hepatitis B or hepatitis C. But in terms of the most prevalent, this may not be something that's very common knowledge, but it's really non-alcoholic fatty liver disease. So the medical term for that is hepatic steatosis. So hepatic is just the Latin term for liver, and then steatosis is fat. So it's a fatty liver.
Okay. Are there any symptoms of fatty liver?
So in general, no. People don't actually experience any symptoms when it comes to fat deposition or fat infiltration in the liver. A lot of times it's actually more caught by accidental, or they just had some imaging done or something and it shows that there is fat in their liver. But most people don't have symptoms. They don't complain of any particular symptoms. Now there are some patients that might experience symptoms, and that really depends on the level of fat in their liver. So if there's quite a bit of fat, what ends up happening is the liver starts to get a little bit enlarged. So we call it ballooning. And so it ends up getting bigger and bigger a little bit just from the amount of fat that there is. And if you can imagine, the liver only has so much space in our body to take up. So if it starts to balloon out, it might start to cause some pressure in that area. And so some people might experience some discomfort in the right upper quadrant of their abdomen. But aside from that, it really doesn't have any symptoms when we're just talking about fat in the liver.
Okay. How do you diagnose fatty liver?
So I alluded to this idea of abdominal imaging. Most commonly, the way that people figure out that they have a fatty liver is generally it's an abdominal ultrasound. So, if patients say, go to their family doctor, they say, I've got some discomfort in my belly here or there, family doctor will order an ultrasound looking for something, and then it'll comment on the fact that there's some fat in the liver. That's the most common way that people get to know that they have it.
What about blood work?
Yeah, it's a good question. So, a lot of people do find out that way as well. So when they do blood work for just routine testing or any other reasons, if you're just going for like a physical or annual assessment with your family doctor, they'll generally get you to do blood work. And one of the parameters or one of the things that we look at is the liver enzymes. And so if these liver enzymes are abnormal or elevated, that might trigger the family doctor to then order the ultrasound. You can't really diagnose someone with a fatty liver just based on blood work, but the blood work can give you a hint that there's something going on, which then will trigger the next step. And that's, again, the ultrasound.
Okay. What are the complications?
So when we talk about fatty liver, it's not so much as just the fat that causes the problem. It's fat plus if there is active inflammation in the liver. So there's two sort of ways to characterize fatty liver. One is just to say that they've got a fat deposition and it's really not doing anything. Then there's fatty liver with abnormal liver enzymes, but that's really because there might be some active inflammation in the liver. So that is what we call steatohepatitis. So that's when the fat is causing inflammation within the liver cells. So the liver does not like having the fat there. So those two are a little bit different, but really one leads to the other. And when you get inflammation, the complications depend on how long you have this inflammation for. So if you have it for many years, so if you can imagine inflammation chronically there for years and years, things start to change in the liver. And one of the most common things that happens is what we call fibrosis. So it's scar tissue that basically starts to form in the liver. So if you can imagine, if you burnt your skin, and it can, if you burnt it superficially, it will heal. But if you keep burning it every day, eventually you're going to get a permanent scar. Yeah. So similar to the liver, if you have chronic inflammation in the liver, you will eventually develop scarring that can become permanent. And if that continues, it gets even more advanced. You then start to get very stiff liver and nodularity. That's just basically the shriveling up of the liver. The cells just don't work anymore. And so the most advanced complication you can get with a fatty liver is cirrhosis. So that's advanced liver disease. And a lot of people think, well, if I don't drink any alcohol, I shouldn't get this. But that's not true. And this is one of the most biggest concerns about our population, with the prevalence of fatty liver being up to 50% of the population now. And then a subset of those people will develop cirrhosis because of this chronic inflammation. So cirrhosis is sort of the biggest complication you can get from fatty liver.
Okay. How can you tell if someone will develop complications associated with a fatty liver?
That's a good question. So if you remember what I said about the idea of having fatty liver that will eventually progress to having this active inflammation, right? Okay. So you go from just having a fatty liver to steatohepatitis, or we'll call non-alcoholic steatohepatitis. That progression, a big part of the risk factors that leads to that is really what we call the metabolic syndrome. So if you have other problems in your health, so if you're overweight, so obesity is a big risk factor, diabetes, so type 1 or type 2, usually more so likely type 2, if you have high blood pressure, high cholesterol, and other cardiovascular disease risk factors, all that will increase your risk. Age is also a factor, and we see it a bit more commonly in men than we do in women, but both are still quite high risk as you get older.
Okay. How do you treat it and how do you prevent it?
So if you were talking about simply fatty liver, patients that I see in my clinic, the primary way to treat it right now, so if we have someone with active inflammation, the treatment really is about the same thing as how you try to prevent it, which is really taking care of your diet. If you're overweight, trying to lose the weight. If you have diabetes, if you have high cholesterol, if you have other cardiovascular risk factors, like if you're smoking and so forth, it's really about trying to cut all those out, or trying to at least control these risk factors. So high blood pressure, make sure it's controlled. High cholesterol, make sure it's controlled, whether it's through diet or through a combination of it as well with medications. So that's how you try to treat. Prevention really is just about trying to prevent from getting to that point, right? So not overeating or excessively eating, trying to exercise, and trying to ensure that you're on a healthy diet, and making sure you're checking up with your family doctor. They check your blood pressure, cholesterol, and if any of these are abnormal, you want to control it if it gets out of control.
Okay. Is there any particular diet you would recommend?
So generally speaking, there isn't one specific diet for everyone. It's just because one diet doesn't work for everyone. Just like, if you talk about exercise or different ways to lose weight. I essentially try to promote healthy habits, and I try to get people to ideally lose about 5 to 10% of their body weight at the time that I assess them. It's kind of like a first step goal, and you don't want to try to overreach, because people will fail that. But when we talk about specific things in the diet, we really try to review what somebody's currently eating, and generally speaking, we can find certain areas that you can work on, and we look at things like carbohydrates. So a lot of people tend to eat a lot of processed foods, high carb rich foods, lots of sugar, or lots of fats, or trans fats and so forth. So what we try to get them to do is reduce that consumption, potentially reduce the portions of their meal if they're eating quite large plate, you try to reduce it. Try to focus on more lean proteins, vegetables, drinking more water, less of the other stuff like exactly, Coca-Cola or like any of these like quite high sugar drinks. Juices as well. People think fruit juices are healthy. They're not. They're just packed with sugar.
Even the natural ones?
Even the natural ones, right? Because if you're just squeezing, you're just really getting the juice, the sugar out, right? So it's you're not getting
the fiber out.
Exactly. You're not really getting the nutritional aspect. Don't get me wrong, fruits are good to have, but you also have to control how many fruits you have per day. More focus on the fiber, so vegetables and lean proteins. And then any other, coffee actually has been shown to actually be good for your liver, but black coffee. So if you drink 2 to 3 cups of black coffee a day, that tends to be good for fat. Then we encourage other things, not just diet, right? Like it's a combination of ensuring sleeping well and also exercising a few times a week where you're getting more into the aerobic type of resistance exercises.
Amazing. Yeah. Where do you think research should focus on for this condition?
Yeah, so I think one of the biggest things is really trying to first encourage the population more in the sort of a public health standpoint to get more active, eat healthier. I think a lot of times, I think a lot of our, what we see on TV isn't really conducive to healthy eating or healthy habits, trying to avoid fast foods, but we see commercials everywhere. So if we can't really, if we're seeing that we're really lost the battle in trying to convince people to do more of the healthier habits, then research really needs to focus on ensuring that these other cardiovascular risk factors are under control. Right now there is quite a bit of research on trying to find maybe medications that will essentially shave the fat from the liver, just trying to reduce the fat deposition, which hopefully would reduce this risk to progression to fibrosis or scarring. So I think that's where research is now heading towards. Ideally, like I said, I'd like to see not more medications, but at the end of the day, I think if we're sort of forced to find another alternative for people to try to keep their liver health, this is probably where it's got to focus on, trying to get this, reducing this risk of progression of fibrosis and trying to cut that link somehow off.
Will any kind of complication will lead into a surgery if like we didn't reduce the fat amount in the liver?
So there is no, we can't really do surgical, like just to shave the fat.
Yeah.
I don't think that that's where the research is going to, primarily because that's a high risk. But as you know, there's surgeries for weight loss, right? So you look at bariatric surgery for gastric or stomach bypass, or you do laparoscopic banding, or there's other ways to try to shrink the size of your stomach or bypassing so you're not absorbing as much. And so a lot of people are, sort of heading or have done that. And there's also medications for weight loss, right? There's ones that are being used right now to help people lose weight if they can't do it on their own. And that has shown some promise to help reduce this inflammation in the liver.
Okay, Thank you so much, Dr. Raed, for coming today and sharing all this information with us.
Oh, it's my pleasure. Thank you for having me.
Thank you. Thank you for watching us today, and watch us and wait us for new episodes coming soon. Thank you.
Thank you.